Alone, we can do so little. Together, we can do so much. I'm a clinical social worker, and I've been working in the field of social work for about 15 to 20 years or so. Work in addictions and HIV and public health most recently. Been working with Franciscan to really address population health and really work together as a partner organization to be a force multiplier in your community to really address and prevent liver cancer and find hepatitis C in the community. This is a huge project because hepatitis C is the largest infectious disease outbreak of our time. The majority of people who have hepatitis C don't know that they have it, and a lot of the misperceptions about hep C is that people acquired it through drug use or otherwise. The fact is that because it's the largest public health outbreak of our time, baby boomers who hold the largest burden of hepatitis C. So hepatitis C lived in our blood and tissue supply for about 20 to 30 years before we found it in 1989. And the other reason it's so powerful is that it's the only virus and infectious disease that has been identified and cured, and with a cure in 25 years. So people don't realize that they can take a pill once a day, very few side effects, to ultimately cure them of a virus that would eventually cause cirrhosis and liver cancer. So I work for the small nonprofit called the Caring Ambassadors Program. Our mission is to empower people to be ambassadors to their own health, and we do that by educating, advocating, and supporting for patients and communities. So I've been working with Franciscan Health for a couple of years now to ultimately help integrate hepatitis C services into their medical infrastructure. That's through increased visibility with articles and posters, training with physicians, and most recently we've been able to secure a grant with an additional partner, Gilead Pharmaceuticals, to bring in a focus project. And this project specifically works to screen and integrate linkage to care for hepatitis C services into your medical infrastructure. So the Franciscan Health Foundation and Caring Ambassadors has been able to sustain our years of relationships because of the harmonious model in which we work. We're able to work together to build a plan and tackle the plan and then say, wait a second, that worked and that didn't work, and let's readjust and be able to find a way to bring more money in to continue to do what we do well. I think what works well in terms of the element of being in harmony is we don't always have to know the answer, but I think because of the mission-driven work of both of us, we're able to guide by intuition of what's right. I think because of the role that I play locally but nationally within the Caring Ambassadors, I'm able to continue to inform the foundation around, hey, this is what I'm seeing, this is my suggestion on where we go. And then the inherent resources that the foundation has available to them, from the teaching hospital and the residents and the marketing, all of these various components makes our job easier to tell a good story well in full. So that harmony really helps us to continue to hopefully bring money in and continue to serve your community. I'm Jill, and I love Franciscan.